My colleague, Senator Cassidy.
Mr. Kazoukas and Ms. Newman, I'll focus my attention on you at first. You both come from academic backgrounds. You both have a lot of experience with this. And I understand the role of the trustees is to kind of bring a different perspective to something which is otherwise kind of within the club, if you will. Now, for example, I understand that there's a controversy where the Social Security actuaries presume that replacement rate will be about 2 kids per family. CBO claims 1.75, and there's others that say it's actually closer to 1.65. And then we have the other influence of continued immigration, which kind of offsets. Now, that's going to make a huge difference. So can you describe your approach as to you're coming into a group which kind of has a set perspective, and yet credible outside sources say maybe that perspective should be challenged. They may be right, maybe not. How would you handle that? Ms. Newman.
That's a good question.
Thank you, Senator. And I appreciate your leadership on raising the visibility of issues and challenges facing Social Security, because I do think these are very important issues. The work of the public trustees is very technical, and reviewing assumptions is extremely important because any change in assumptions can have major ripple effects down the road. I think the role of the public trustee is to bring a fresh set of eyes to the decisions that have been made, to bring in experts from outside to be...
Now, I like what you're saying, but everybody wants to be liked. And as soon as you begin challenging assumptions of folks who have kind of settled on those assumptions, there's always a sense of perhaps being ostracized, et cetera. And so I guess what I'm asking you, are y'all willing to at least challenge those assumptions, understanding you might be the fly in the ointment?
Well, I like to think of myself as a straight shooter, and I understand that people might disagree, but I would certainly be comfortable raising questions and doing my best to, if there's conflict, there's conflict. But I'm not going to shy away from raising questions and confronting assumptions if I think they're wrong.
Mr. Kazoukas?
I don't think I could have said it any better myself. I agree wholeheartedly with that, and I also add that my experience has been that it's not necessary to always be perceived as a fly, that sometimes this is about people understanding that we're all working toward the same end, and I think that that's important in carrying out a duty like this. So I would say that my role here, if confirmed, would be to understand the perspective of the professionals who work on these issues and what their viewpoint is, to ask good questions like Dr. Newman said, and then ultimately, in the end, that suggests that perhaps what's most important is some level of transparency about what assumptions are being made, how something like replacement ratio is being described and calculated in the report.
And let me just interrupt because I have limited time, but echoing a little bit what Senator Crapo asked, which is how can you communicate with us? Frankly, you would have to educate us on the importance of these ripple effects. What may sound like a small detail, we understand makes a huge difference 10, 15, 20, and 70 years down the road. Mr. Kazoukas, let me ask you this next question. My staff confirmed to me, but the Medicare trustees effect often focuses on the HI fund, Part A, and doesn't really pay a lot of attention to B and to D. And yet there's some evidence that when George Bush passed the Part D program, that it had a positive effect in terms of reducing hospitalization. So there is a dynamic iterative effect. If you do something here, it actually benefits there. And in terms of the global budget, we know that has a big effect. So if you only focus on HI and you don't focus on the Part D program, my gosh, maybe we're spending a little bit more on drugs, but we're saving a lot of money on hospitalization. You kind of miss an important story to tell. How would you handle that, sir?
I think that, Senator, this is an example of how the trustees can contribute to the conversation. And while there's a lot of attention focused on the solvency dates and the like, and those are really important things, what's also really important in the work of the trustees is the information and data they provide around the program, the mechanics of the program, and the why and how they make the calculations they make. And so the kinds of issues that you describe are things that the trustees have work around and explain, in their reports. And I would look forward to having the opportunity to address these.
Almost out of time. Ms. Newman, would you add anything to what he just said?
No, I actually agree, and I think it is the role of the trustees to look at all parts of the program, A, B, C, and D, and look at the interactions, and I believe that's what they do, but I think what the public trustees can add to the conversation is making sure that the effects of, say, Part D, drugs, on Part A are clearly understood when the report is released. The report is long. It's got a lot of technical information, so it's sometimes hard to see what's embedded in the report.
If the chair will indulge me, I'd also ask that you help us put that in the scope of the entire federal budget, because we're going to pay for B and D separately from A. We may pay a little bit more here, but save a lot there. And if that's not delineated, we may not have that understanding. You've been indulgent, Mr. Chairman, and I yield.
Well, I just want to say to my colleague that I very much look forward to working with him on these issues. And we were talking with Ms. Newman, for example, about some of the other emerging trends, like chronic care, which came out of this committee. And apropos of your point with respect to Part D, I was one of the Democrats who voted for Part D, took an awful lot of flack for it. And I went looking, for example, at the effects of Part D on these other kinds of programs as you talk about. And we need that kind of information. So I want to thank my colleague for this approach of looking to these emerging trends, and I look forward particularly in terms of healthcare working closely with you.